like to show you what a herniated or bulging disc is. A herniated or bulging disc is basically the same term that different types of doctors use. But normally when we look at the disc, it should not be rubbing into this nerve. Sometimes what happens is pressure gets accumulated on the vertebrae and it shoves down on the disc, and the disc will push back into the nerve, just like this. What we do with chiropractic care is get the vertebrae repositioned properly so it takes pressure off of the disc, alleviating pressure on the nerve, and the person feels better. If the disc is ruptured or if it's herniated to an extreme level, sometimes we have to refer a patient to a surgeon. When a surgeon works on a person's spine, one of the things they have to do is clip out that disc bulge. Then they put brackets around the vertebrae to stabilize them.